In 2008, we had 5 new members elected to the Mesa City Council. And at that time, we were faced with a very interesting challenge in terms of service delivery to our residents, changes in delivering care to residents, responding to calls for service. And it was increasingly clear to us that Mesa Fire was becoming the primary care physician for many of our residents in the community. And you combine that with difficulties in getting ambulance service and hospital emergency room waits, sending expensive $1 million trucks on medical calls for people who had the flu, or having the trucks with 4 crew members sit at an ER for hours and hours. It was really taking its toll, and it was clear to us at that time that there had to be some changes in the way that we were doing business, changes in the way that we were delivering service.
Having worked in the emergency department and seeing patients who had come in with fairly trivial problems who, sometimes by no fault of their own, had not been able to access health care in probably a very efficient manner, when they said that, hey, we're going to treat patients in the field, or we're going to refer them to more appropriate health care avenues, it seemed like a fantastic idea.
Water the plants. I dropped the carton, the whole bottle, and the water spilled. When I went to step out of the water, I slipped into it and slid. And I don't know how I hurt my knee, but how did I cut my finger? I don't know. I mean, I was holding my hand up like this, thinking the blood wouldn't flow so bad as holding it down. And my palm was filling with the blood, and the blood was just running down. Oh, I didn't want to go to the hospital because right away they think they give you 1,000,000 things and every test imaginable for anything they can think of.
Now for the hand.
You know, the people from the fire department were really pleasant, and they showed up as long as they could get here. And she sutured the little finger, which was right close to the palm. She did a long stitch and equivalent to 20 stitches.
About, yeah.
Mm-hmm. I think it's absolutely fantastic. Impressed my friends very much, impressed me very much.
The ultimate aim is to provide better care for the patients. The patients, when we explain the program to them, it's typically not what they expect, but they're pleasantly surprised and appreciate the fact that we're coming out and taking care of them, and they don't have to go to the emergency department.
The private sector, I think, has partnered with us well, and the public as a whole really has benefited in terms of health care. As city council members, I think we feel that we've tried to be good stewards of our resources to be able to meet needs the department provides to us, and again, to be very open to new ideas.